Pinto Fontil, Executive Director, Ambassadors, members of Diplomatic Corps,
development partners,
Director Generals, National Directors and Chief Departments, Ministry of Health, national and municipalities, ladies and gentlemen. Welcome to the closing ceremony of the Usaid Health System Sustainability Activity in Timor-Leste, celebrating achievement. For your information, this will be live streamed on televisions of Education Timor and the Facebook page of Usaid.
bem-vindo a mais cerimônia de encerramento, no vai então botar a informação, esta é a live streaming e a televisão em Educação Timor, no nosso Usaid página Facebook nia.
My name is Bepi,
How dear Stefania?
as Masters of Ceremony. Before we commence, please rise for our prayers, led by Mr. Mario Guzmão.
Convida ita hotu, hambrei coração.
His Excellencies, distinguished guests and participants, we will do the prayer in Catholic beliefs, and it will be in Tetum. For those who have a different faith or beliefs, please do prayer in your own. Holy Padre, Holy Padre, Holy Filho, Holy Espírito Santo, Sirenaran. Amén. Nine, Aman Santíssima Trindade, a me agradece, valoram fom ira oin, amissimo, hosita nia diak tomak, a graça, no benção ain, liusi vira, saúde, no diak tomak, uri halibor hamutu kami, e a momento irane, ori celebra atizimento sira, nebe Usaid nia atividade, va sustentabilidade, Sistema Saúde e Timor-Leste, a mútuo com o Ministério da Saúde, parceiro, organização, sociedade civil, será atingiona durante né, e ao mesmo tempo nós encerra a atividade irane. Nain aman santo, beite limang amiarohan, oritulun, taumatan, no acompanha a misirane, e eventualmente non è bella la odia o remata. A minha saimosa, a minha oração irene, na minha acompanha no raikna fatin, graça, sabedoria, matene, no dia toma ba a minha governo, li justi Ministério da Saúde, parceiro de desenvolvimento, no doadores, sociedade civil será outro a tu colaborar. Lolo lima bamalu, a força liutan, sistema saúde Timor-Leste, non è belle lori, non fornece assistenza saúde e dia, no qualidade liutan, o di belle a menos, numero mortalidade no morbilidade, liliu, ba ina no ansira, o di belle atingi metas governo no Ministério da Saúde nia, a tu assegura povo ida saudável, e a nevena nação neve saudável. A minha rohane, ori a minha Jesus Cristo naran, a mutu que é Espírito Santo. Ori Padre, Padre, ori Filho, ori Espírito Santo, sirenara.
Obrigado, Barak. Senhoras e senhores, será a favor, turno.
Beforehand, there will be a presentations of ties. Ladies and gentlemen, please welcome His Excellency, the Vice Prime Minister and Minister Coordinator for Rural Development and Community Housing, Engenheiro Mariano Assanami Sabino. A round of applause. E Totani Basali Mauricimo, His Excellency Vice Premier Minister. Ladies and gentlemen, please be seated. Mede ita bot sire minuto ida sa fotografia hal for. Obrigado, media. Al favor, bilhola falita votos somnifati. Excellencies, ladies and gentlemen, now there will be a presentation of ties and as an appreciation and welcome to our VVIPs by Chief of Party, Mr. Bhavesh Jain. Therefore, we would like to invite to the stage once again His Excellency, Vice Prime Minister, Minister Coordinator of Rural Development and Community Housing. Excelência, me convida a Maheletem para estar a tais.
We would like to invite His Excellency Dr. Flavio Brandão Mendes de Araújo as Vice Minister for Hospital Operationalization, Acting Minister of Health.
And we also invite His Excellency Mark Weinstock and also Mana Rebecca Robinson, as well as Director of Fontil, Sr. Valentim da Costa Pinto. First of all, to His Excellency the Vice Prime Minister.
And the second one to His Excellency Dr. Flavio Brandão Mendes de Araújo.
And next to Secretary of Affairs, Mr. Mark Weinstock.
And the next one to Ms. Rebecca Robinson, Acting Usaid Mission Director.
And lastly, to Executive Director Fontil, Sr. Valentim da Costa Pinto. One photo together. So this is an appreciation and welcome to our VAPs. Thank you very much, Excellencies. Please return to your seat once again. Thank you. We will now commence the ceremony with the traditional dance performance from Kairala Cultural Association with the dance titled Chele Chuku.
Terma encerra a apresentação dança tradicional da Rússia, Associação Cultura Kairala, o título Chele Chuku.
Chele Chuku is a dance from one of the Timorese municipalities located in Los Palos. Chele Chuku dance usually dance in traditional house. Chele means corn, or in Portuguese, milho, and Chuku means communities unite to dance, sing, and value for what they've got from their corn harvest. This then represents our ancestors. Used to have corn harvest every day and dance as welcome, and also dance to welcome guests in our traditional house. Without further ado, ladies and gentlemen, please welcome Kairala Cultural Association. Ito Tony Vasalima. Once again, a big round of applause for Carrera Cultural Association. First of all, we'd like to invite Mr. Bhavesh Jain, Chief of Party, to deliver a brief journey of health system strengthening and the Usaid Health System Sustainability Activity in Timor-Leste and the key achievements.
Senhor Braves Jane, sehato apresentação com a jornada fortalecimento sistema saúde neve cobre os Usaid e Timor-Leste no linha atendimento sira. Por favor.
His Excellency Mariano Ami Sabino Lopes, Vice Prime Minister, and the Minister Coordinator for Rural Development and Community Housing. His Excellency Dr. Flavio Brando Mendes de Arauzo, Vice Minister of Hospital Operationalization and Acting Minister of Health. His Excellency Mr. Mark Winstow, Secretary of Affairs of the U.S. Embassy. Ms. Rebecca Robinson, Acting Mission Director. Mr. Valentin Pinto, Maukoko, Executive Director Fontel. Excellencies, Ambassadors, and members of Diplomatic Corps, Director General, National Director, Head of the Departments of Ministry of Health, and senior officials and line ministries, bilateral partners, UN agencies, national and international NGO partners, distinguished participants, bon dia. A very, very warm welcome to everyone to celebrate the achievements under the USAID Health System Sustainability Activity. But these are really the achievements of the people of Timor-Leste and its health system. Today, on behalf of my amazing team, I'm proud to share some of the results from the activity over the last 3.5 years. We started the activity somewhere in July 2021. And we're committed to support the Ministry of Health in its effort to strengthen the health system. The aim was to use the strategic goals of the Ministry of Health using the National Health Strategic Plan 2020-2030 with a clear focus on improving sustainability and resilience of the health system. And this was especially challenging as we started during the COVID-19 pandemic times. The activity took system strengthening and integrated approach in its implementation. The aim was definitely to help Timor-Leste people, to provide them high quality of care, equitable care, efficient health care in a manner that is accountable and responsive to the needs of the people. The activity with the leadership of the Ministry of Health, who facilitated this change process in 5 key areas, which includes health governance, human resources for health, improving healthy behavior, and most importantly, social accountability, and also COVID-19 response. Maybe I'll go very quickly through key achievements, and then later you can also look at some detailed achievements from our team on the left side of mine. In the area of governance, we developed, implemented, and institutionalized leadership management development program for senior officials of the ministry in partnership with the the National Institute of Health, INSPTL, as well as St. John's of God International Health. This was first of its kind of a program to support the Ministry of Health to build capacity of senior officials in leadership. In addition, we also supported the ministry strengthen their internal governance procedures, which included delegation of authority as well as handover procedures. The activity also supported some of the governance-related activities with a big G, which is around supporting the ministry in having a dialogue with the private sector healthcare based on evidence. The activity also supported the ministry in analyzing health financing data and public financial management strengthening by institutionalizing health financing unit and establishment of that. Also conducted numerous training programs to strengthen the health financing and PFM practices, effort to make efficient use of resources. We all know data is very, very critical for any health system and for a successful governance. So we address this imperative through several activities to strengthen the Timor-Leste health information system. Our in-kind grant to the HMIS department improved internet connectivity and technical capacities of HMIS officers, which led to improvement, timeliness, and completeness of data in 13 municipalities, from over 40% to 90% just within a period of 1 year. This improved the decision-making for healthcare. On human resources for health, we supported the Ministry of Health in recruiting and retaining qualified and competent healthcare workforce in the country. For that, we collaborated with the National Directorate of Human Resource to revise the Ministry of Health HR manual and also co-develop 40 job descriptions for primary healthcare cadre. Based on these capacities developed, the Ministry of Health on its own now are developing more than 100 job descriptions for secondary and tertiary care. This has helped create a system where all health workers have equal access to employment, professional development, and promotion opportunities. The activity also conducted a health labor market analysis to deepen the Ministry of Health's understanding of the current scenario of HR in the country and help inform the next national health sector strategy as well as the national strategic plan for human resources for health. We also very closely worked with Association of Medical Doctors to develop standard competency standards and code of ethics for medical doctors in the country, which will help long way in improving quality and patient-centered care. The third objective was around increasing community adoption of healthy behavior and influencing social norms that underpin those behaviors. We very closely worked with the Ministry of Health, especially the Monitoring and Evaluation Department and Health Promotion Department to strengthen and expand community-based monitoring for health program. 3 municipalities, Anufahi, Ovalima, and Armera. This initiative was implemented in partnership with local CSO, EM Health, and SHC. Under this program, we established 19 village health assemblies comprising of community members from different segments of population, and right now are transforming how people interact with health facilities. These communities use these assemblies as forums for community dialogue and developing local plans for their own health issues. This has so far benefited many pregnant women and under 5 children to receive immunization and nutrition support. This program has not only strengthened the community engagement, but also strengthened organizational and technical capacities of our CSO partners to implement, monitor, and evaluate healthy behaviors in their own community. The fourth objective was focused on strengthening civil society organization and bringing them much closer to the Ministry of Health. We began working with Council to organize countries' health sector CSOs under one umbrella for effective advocacy. And therefore, the country's first network of health CSOs, Rediba Saudi Timor-Leste, was launched in May 2022. Under this, 43 health CSOs became part of this pioneering network. They are now using this Rebastiel forum to more effectively engage with the Ministry of Health at all levels, both at the national as well as at the municipality level, provide constructive feedback from the community to improve health services. This helped more progress towards a better social accountability, which is sign of any good performing healthcare system. We awarded grants to Fongtil and Rebus to strengthen their capacity to better engage with both with the communities as well as the government, especially with the Ministry of Health. The activity also launched e-learning platform to develop the capacities of these CSOs so that they can use information effectively. This was done in partnership with Usaid implementing partner Usaid NGO Advocacy for Good Governance activity. This platform is now enabling better knowledge, sharing, and improving coordination and cooperation among CSO partners. Lastly, on COVID-19 response, we had an opportunity to supplement the government's effort to tackle COVID-19 pandemic. Through the activity, we began supporting the ministry and partnered with local CSOs, especially Hamnasa, to accelerate equitable access to vaccines. Together, we trained 600 plus role models in the community to support, mobilize the community, and contributed administration of 80,000 COVID-19 vaccines. The activity also supplemented training of 300 and plus healthcare professionals on emergency care, laboratory diagnostics. At last, all these efforts needs to be sustained. So activity has been successful in making a little dent by bringing organizational shift from one-time support to a system strengthening approach, which is more long-lasting. These initiatives and reforms are not just one time, but are institutionalized by creating teams of champions instead of just training. Many of these initiatives are now financed by the government budgets. At the end, over the years, the activity has developed more than 45 different knowledge products, learning briefs, which are now creating a good knowledge base for Timor-Leste's health system. These resources are now available publicly on the website. Please feel free to note down the QR code and download these materials. With this, I would like to end to acknowledge that all the appreciation actually for the support of various development partners, especially World Health Organization, BFAT, PhD, the World Bank, UNICEF, and all other development partners for their active cooperation, without which it wouldn't have been possible today. I would sincerely acknowledge our grantee partners for their commitment to improve health system and services. The leadership of the government, particularly the Ministry of Health, at every stage of the activity is saying for itself today as we celebrate the success together. Lastly, I want to highlight the role of my amazing team who took up this new challenge and strived sincerely to achieve these results we are celebrating today. I would like to sincerely acknowledge the US government and USAID leadership for bringing this strategic shift in system strengthening approach and help improve the health system, bringing some lasting. With that, I would like to end my presentation. Thank you and obrigado.
Thank you very much, Mr. Baveshan, Chief of Party, with the USAID Health System Sustainability Activity. Ladies and gentlemen, next is a video presentation on USAID Health System Sustainability Activity, Achievement and Testimonies.
Senhoras e senhores, termai video apresentação com a atendimento no testemunho com a atividade sustentabilidade sistema saúde USAID nian hanya sang termai maita sistema mutuk.
Iha fulang Mayo tinan rihun rua nulu resen rua, Timor-Leste celebra tinan rua nulu restauração independência. Resultado ida nebe significativo banhira nação harefa lebacoto, minia esforço atu hadia qualidade moris baninia cidadão toma. Mas que progresso iha ona impacto husi aspecto o imba governação Timor-Leste nian, mas be sistema saúde hatudo kata se precisa hodia força dia klutam. Necessidade ida nebe claro husi indicador sira nebe sukat malnutrição, no labarik nia mortalidade. Indikação nebe ATVs ia tinang rihung rua nulu sen ida, no pandemia COVID sa nulu resensia, hatu tentang tambasa precisa sistema saúde ida nebe forte. Plano stratégico nasional setor saúde badala rua, ia tinang rihung rua nulu to rihung rua tolo nulu, reconhece necessidade basema saúde ida nebe forte. Governo Constitucional da SIA iha compromisso atu implementa política nacional saúde, o plano estratégico nacional setor saúde, atu avança visão Timor-Leste saudável e nebe moruan hotu belhetang acesso ba cuidado saúde e nebe ho qualidade. Governo Estados Unidos América liusi Usaid cria ona laço parceria ho governo Timor-Leste hodi suporta desenvolvimento nebe peluang no sustentável. Iha tinan rihun rua nulu resengida, halau lançamento ba USAID ni atividade ba sustentabilidade sistema saúde, hodi suporta Ministério Saúde, Instituição Nacional Saúde, no instituição Siraseluk, atu desenha no gere serviço saúde ou qualidade para o povo Timor-Leste. Fundo SUS USAID tokong sanulu resen 5.9 nini objetivo atu hameting governação no financialmente setor saúde nian. Gestão força serviço saúde nian, sistema saúde comunitária no engajamento organização sociedade civil sira. USAID mos for fundos adicional tokon ida.nen lihusi atividade hodi suporta governo iha ne luta hasoro pandemia COVID sanulu resensia. Ohi ha foi tinanghat lança atividade ne, ami senti orgulho hodi fahe ami resultado importante balung no insa ami ne serviço contribui hodi hari sistema saúde ida nebe resiliente no autoconfiança iha Timor-Leste. A minha aplica aproximação, usa pensamento no prática nebe sistemático, atu forma sistema saúde ida nebe gere hodiak, eficiente no responsivo ba necessidade população nian. Durante a minha serviço, a mi colabora basic ho Ministério Saúde na instituição Sira, no parceiro local Sira atu dezena desenvolve no implementa a mútua solução Sira ba sistema saúde ida nebe sustentável. A minha serviço da hulu focaliba hadia setor governação, financiamento, qualidade no utilização dados saúde.
The activity supported the Ministry of Health and civil society organization to refocus on health system strengthening rather than on health system support, and ensure that the capacities which were built stay within the local systems. For example, the activity helped co-develop job descriptions and performance evaluation of primary healthcare worker, but also helped the HR department to continue developing these tools for secondary and tertiary level care. In the process, the activity also engaged Rediba Saudi Timor-Leste, a health CSO network, to be engaged in the process with other stakeholders. This is how the activity brought into system strengthening, systems thinking in its approach, but also focusing on localization and sustainability.
Atividade nel serviço da rua focaliza hadias estão forças serviço saúde nian e Timor-Leste. A minha objetivo mak atu apoio ministério hodi recruta não mantém forças serviço saúde ida nebe qualificado não competente honinia distribuição nebe justo.
Se ita hare jornada de desenvolvimento do setor saúde, Usaid ini yang contribuição como sequer susi início nação neoconal que o mai é agora lili setor saúde. Usaid ini yang apoio liliu ba ia fortalecimento do sistema da saúde. Mas se ita hare ba apoio sir nebe maka ulukal tomai agora apoio ida nebe maka agora dauk lihu si health system sustainability activity ne hanesan apoio ida nebe maka bele sita liu bele ênfase liu ba iha reforma iha sistema da saúde ida ne hanesan contribuição nebe maka significante tebes atau bele dinamiza liutan funcionamento do sistema da saúde iha railara. Aunin hatau parabéns ba iha equipa tomak nebe liderana projeto atividade dane atividade ne bolnaran health system strengthening health system sustainability activity hono kata kau congratula ba ita bot sira hotu serviço de actividades espera kata ita bot sira hotu kare ke projeto sira tu irmai ita bot sira bele balong bele continua fal atau nune cultura gestão ne bedia kanesne bele continua na faten ba fase sira tu irmai.
A minha serviço da tolo focaliza hadiah halok saudável não mobiliza a comunidade onde sai paciente ativo e a saúde.
Dalam cobertura saúde universal itu quando atinge itu precisa ia buat barak. Primeiro hareba iha envolvimento comunidade. Iha galai sociedade civil, iha galai recurso, iha galai infraestrutura, nomos medicamento, nomos sera selo. Ministério Saúde bele ho esforço sira tomak mobiliza recursos ne mas sem comunidade na participação envolvimento e a processo serne sei lá atingir cobertura saúde universal hoje da nema kami esperança kata ko programa nebe agora da clau envolvimento a sociedade civil nomos comunidade raça.
Atividade nel serviço da HAT focaliza força sociedade civil Timor-Leste ninian capacidade atu participa ho efetivo liu iha setor saúde.
Idane amionoeng hodi fontil nenarang nomos secretariat Rediba Saudi Timor-Leste nenarang hakara ka aprecia agradece teves pa apoio hoto tu nebeke mai husi Usaid o governo América nebeke fotulum ba equipa atividade hametin sistema saúde e lihusi liderança mambabe so nimiti nebeke halo serviço macas los e serviço lacole horibel continua for assistência técnica nomos apoio financiamento ba fontil Rediba Saudi nini existência e hona mudança significante nebeke halo que agora da Ministério da Saúde tanto em nível hototo bele sayona nesan permite kata rebasa nesan sirni equipa serviço ida que lá osona nesan sociedade civil nebeke bem halo prática diferente.
Pandemia COVID-19 resensia e hatinan rihun ruanulo to rihun ruanulo resengida apresenta desafio ida nebe nunca acontece antes ba sistema saúde e Timor-Leste. Iha momento neba Usaid lihusi atividade hahufo apoio ba governo Timor-Leste hodi responde ba COVID-19 resensia. Ami parceria ho OSS lokal Hamutok na sang saudável, hodi acelera acesso no entrega vacinação Covid sa adolescência, nebe seguro no efetivo. A minha apoio cobertura ba administração 12 vacina Covid sa adolescência, hamutok rihong 80.8 iha município nen. Ho taxa vacinação nebe kik, ida ne aumenta taxa cobertura vacinação iha município nen.
Kolaborasyon com a parceria nebe maka Ministério da Saúde halo Usaid durante ne programa sustentabilidade sistema da saúde. Colaboração né halo entre Ministério da Saúde e Usaid e depois Usaid e INSPTL. Mereka taka hatu duduni resultado nebe maka significativo teves. Hal significativo teves ini dilihat area recursos humanos no sistema informação da saúde. Aspecto ruane maka avanço los hetan avanço dia close tambah kolaborasi dia ita teni katak dia husi hanesam parceiro Usaid hanesam parceiro ida importante mai setor da saúde mai ministério da saúde nebe halori Sosialisasi Ministra Ninaran, Servisi Ministro Operasionalização Ninaran, Menusa Ninaran. Kebetulan agora hawane sang hela Ministro da Saúde em exercício, em nome do governo, hakar lese, ba esforço tomak mereka pa instituição rua kalau. Agradece ba estrutura tomak Usaid nian o governo americano nebe maka ihane ambassador Amerika ihane divisi Usaid dele apoio a dia anai apoio nebe maka kami propõe ba sempre ia atenção anai ne itania parceria dan nebe dia.
The USAID Health System Sustainability Activity is the first of its kind in Timor-Leste. As a health system strengthening activity, our efforts have delivered on its promise to drive improvements in the quality of healthcare delivery now and for years to come. The activity has had deep and wide engagement across health governance, financing, information systems, and community and civic engagement in Timor-Leste's health sector, which is critical for long-term success. On behalf of USAID, I want to sincerely thank the government of Timor-Leste, the Ministry of Health, and all our partners who contributed to the success of our health activity. Our partnership was truly contributed to the well-being of Timorese citizens. All the development support USAID provides strives to make an inclusive, prosperous, and healthy Timor-Leste that is more self-reliant. This health systems sustainability activity has paved the way for a more healthy and strong country. Obrigada.
manula sim do Constituição. Mas que o quadro legal, no estratégico sira, não é claro, política, no alanija econômico, para o setor saúde. A tudo que ataca, responsabilidade social, e setor saúde, tem na fato em faco. A tudo que ataca, sociedade civil, tem que assai, nem capacidade, para a advocacia, não é que é baseada em dados, e a tempo nessa, autoridade de saúde, tiramos precisa na fato na coloque, para formação inclusiva, planeamento, no envolvimento, não é que responde para a necessidade da população. Faltam desafios que o Usaid em atividade para sustentabilidade do sistema de saúde. Lidera o diretor do programa, Sr. Babezen, com minha equipa, com apoio técnico no financeiro para Fontil e a área de Paulo. Estabelecimento para a rede de saúde de Timor-Leste, que está na repastel, no da rede de advocacia de saúde da Hulu de Timor-Leste, de que a Libur, Organização Sociedade Civil, Hamotuk, Atun Recintolo e o território Larantomac. Rede Dané oficialmente lança aí a Loron Lima, Fula Maio, na Rua Sindrua, com a presença de Sua Excelência no Comidados de Honra, de que serviço e a setor saúde, inclui Sua Excelência Vice-Ministro de Saúde, Sua Excelência Encarregado de Negócios Empresários dos Estados Unidos da América, no representante do gabinete, Primeiro-Ministro. Rabas marca o aniversário da Rua, e a Flancotuc, com realização significante, não se assegura que a continuação para o esforço. Facilita a parceria estratégica entre o Ministério da Saúde e o Rabas-TL, onde faz informação, saúde é importante, onde ele recebe conhecimento no esforço de advocacia em o Rabas-TL. A força, a capacidade, membro do Rabas-TL, Sirenian, a advocacia, baseada em evidência, liu-se mecanismo, liu-se desenvolvimento material de advocacia na beca compreensível, inclui manual facilitador sira, manual participante no toolkits advocacia nia. Iniciativa né, for na matadalang para membro do Bastel a atuar advocacia efetiva, assunto sira na beca relação com saúde a nível nacional, no município, atuaria serviço de saúde na beca qualidade. A força, a capacidade institucional, no técnica fontil nian, e o financiamento, o grant, o papel de governação, para esforço de advocacia, repaste el nian, promove envolvimento cívico e reforço do sistema de saúde Timor-Leste nian. Colaboração com o Usaid em atividade para a sustentabilidade do sistema de saúde, o Usaid em atividade para a ONG advocacia, para a atividade de governação de ACMOS, para desenvolvimento plataforma aprendizagem online e da atuação, coordenação, disseminação de informação, advocacia setorial, com capacitação, organização, da civil e a Timor-Leste. E da se ajuda, sustenta e tenha esforço e tempo na Árabe. Não é? Horizontal na Narang, repasse dela, organização sociedade civil roto. O cara que a minha agradecimento voto para o governo dos Estados Unidos da América, para apoio no BQ Boltebes, nação Timor-Leste, liu, a tu foque de a sociedade civil, a tu foque de papel, a nessan, povo ni matan, filum. A me fiar, que apoio ne se continua. Agradeço Tebes para a liderança do Ministério da Saúde, diretor-geral, diretor nacional, chefe de departamento no oficial saúde civil, para a sirenia colaboração com a organização civil. A me fiar, que parceria da se continua a qualidade da sociedade civil no Ministério da Saúde. Colabora basicliu no fiar que governo América se continua investir pilar principal da tema saúde. A minha mão, a minha pressão para a diretora técnica de Timor-Leste, senhora Rebecca Robinson, ou minha equipa, no nosso diretor do programa de Usaid em atividade para a sustentabilidade de saúde, senhor Babes Jane, ou minha equipa técnica para o meu apoio, na colaboração no BQ Eves,
ami encatak atu continua na fatin cooperação de nei futuro. Obrigado Barak, ba parceiro roto ba minha contribuição nebe polling bot, por for da sociedade civil, atu exercem minha papel ou efetivo. Obrigado ba atenção, no apoio. Parabéns ba Itahoto. Obrigado Barak.
Thank you very much, Executive Director Fontil. Sr. Valentim da Costa Pinto. Excellencies, ladies and gentlemen, we now invite His Excellency, Dr. Flavio Brandão, Acting Minister of Health and Vice Minister for Operationalization of Hospital, to deliver his remark.
O respeito a me convida, Sua Excelência, a favor.
Orang dia baik tahu hauna respeito panai. Vice Primeiro Ministro Eru Mariano Assanami Sabino, Excelência Mr. Mark and Miss Rebecca, haula haluhan bos Ambassador Malaysia, Filipina, Mutu Koite Hade, temos de fato representativo Mutu Koita, diretores, de saúde, colegas profissionais, de Rahotu, deve marcar Mutu Koita Hade. Depois de uma apresentação badak ohin, enti rasa buat kita dari atu ita celebra fale achievement ou atingimento de maka paona ya tempo naro ya tempo inan kolonialaran fight of challenge that we the achievement 3 years period of time with this program activity. I'm pleased to recognize that we able to do something in the situation that we still face many challenges. As we all know that we, through this program, close collaboration within Ministry of Health and Usaid, through this program, we able to design and implement the basic important foundation for the health system. Focus on the strengthening of the health government, health financing, as well health infrastructure. Not only that, through the presentation we can see how all the elements that contribute to the strengthening of our health system is there. And advocacy, we are able to setting up the rebus under NGO forum. And as well during the COVID period, through your support, US Embassy, we are able to covering the vaccination to all our population, as well in the hospital services, we have a mobile ICU through your support. Again, we can see all the support that that's our foundation to build the system, to build our Ministry of Health and our country. We're still looking toward to have a further productive collaboration, focus on hospital governance, introduction, new public management in our leadership program. And there's still more need to do, and on behalf of Minister of Health, I would like to express our gratitude and deep appreciation and close collaboration for future productive collaboration. Thank you very much, and success and healthy for Timorese as one of you activity that have been mentioned, that introduction of health behavior. That's what our Vice Prime Minister here always talk about that. When sama ka halo transformação anoin o halo saudável e a comunidade. É importante teves e a desenvolvimento do setor saúde. Obrigado.
Thank you very much, Your Excellency, Vice Minister. And Acting Minister of Health, Dr. Flavio Brandão. Now, ladies and gentlemen, I invite His Excellency Secretary of Affairs Mark Weinstock to deliver his remarks.
Feita roda de informação, equipamento, aparelho tradução simultânea disponível à direita precisa.
Thank you for showing up today. You know, when I walked through those doors, I was quite pleasantly surprised to see so many people here. I was actually a little bit shocked, but it really speaks to the successes, the achievement of the health system sustainability activity that many of you in this room had the opportunity to be a participant about it. As a CDA, I just get the opportunity to speak to you and talk to you about the wonderful things, but the reality is the work, the successes is really with those that are sitting in the audience today. But before we start the official speech, let me represent the Vice Prime Minister and Coordinating Minister for Social Affairs and Minister for Rural Development and Community Housing, Mariano Asazami Sabino, Vice Minister for Hospital Operationalization, Dr. Flavio Brandão, Diplomatic Corps representatives, UN agency representatives, Executive Director of Fongtil, Valentin da Costa Pinto, General Directors, and Heads of Department of the Ministry of Health, Development Partners and Civil Society Organization representatives, Grantee Organization representatives, Chief of Party, Usaid, Health System Sustainability Activity, Bhavish Jain, all distinguished guests here today, good morning, bon dia, and thank you for your patience today. We are here today for celebration. A celebration of the positive impact of the Usaid Health System Sustainability Activity for the government and the people of Timor-Leste. Launched in 2021, this has been USAID's flagship health initiative promoting a sustainable, self-financed health system in Timor-Leste. Over the last 4 years, this USAID activity has worked alongside the Ministry of Health to build a self-reliant health system that is well-governed, efficient, accountable, and responsive to the needs of its citizens. As the capacity of the Timorese health sector has grown, the United States government has shifted away from providing direct health services. Instead, we have worked closely with Timorese government officials at the national and municipality level, with local stakeholders and with grassroots civil society organizations to strengthen the nation's system of health service delivery. To this end, USAID Health System Sustainability Activity adopted a systems approach in and with all its work. We took the time to understand the building blocks of the existing health system, strengthening the foundation in ways that will continue to deliver positive health outcomes across the country for years to come. As the activity closes its 4-year efforts, I want to highlight some crucial contributions and achievements with the strengthening of Timor-Leste's health system. The USAID Health System Sustainability Act activity has, 1, supported the Ministry of Health and launching a health financing unit, developing a staffing plan, finalizing job descriptions, and conducting coaching sessions and data collection and cleaning. 2, helped improve data-driven decision-making capacity and data-driven reporting, with rates of timeliness and completeness improved by, in some cases, nearly 50%. 3, strengthen health workforce management through the creation of over 40 co-developed job descriptions and performance evaluation manuals that institutionalize competency and merit-based processes in human resource management. 4, supported the Timor-Leste Medical Association to develop the country's first ever competency standards and code of ethics for medical doctors, boosting the professionalism of medical practice in Timor-Leste. 5, expanded community-based health monitoring through village health assemblies across 19 villages in partnership with the Ministry of Health and 2 local grantee recipients. And finally, 6, and there are many more, but we'll stick with 6, mobilize civic engagement and advocacy for supporting the creation of the nation's first network of civil society organizations working in health called Rede Ba Saúde Timor-Leste. The network has helped to train more than 40 local CSOs on organizational management and is now recognized as a core partner to the Ministry of Health. I was privileged to speak at the 2nd anniversary at Rebas TL just a few weeks ago in this same building, although in the other room, which was a little bit smaller, but definitely not as crowded as this one. I could continue to list achievements, but there are many more. For the interest of time, I will keep on going. I do want to point out that all these successes were accomplished through close coordination and partnership with Timorese people. That activity collaborated with the Ministry of Health at national and municipality levels, with development partners, with Phong Till, with civil society organizations, community leaders, and perhaps most importantly, with community members. From recent conversations, we know that the government of Timor-Leste is seeking to generate positive progress that outlast specific programs. This kind of sustainability is designed into all our USAID programming, and the highlights I just listed show that we have achieved it through the health system sustainability activity. The strong CSO network, the new financing unit, the finalized job descriptions, the validated code of ethics, and many other accomplishments will continue to drive improvements in Timor-Leste's health system. I want to thank the government of Timor-Leste, especially the Ministry of Health, leadership, and staff for your continuous support and friendship. I also extend gratitude to Phong Till and to the health-focused civil society organizations, development partners, and community leaders who worked alongside USAID. Your partnership and advocacy has enabled us to deliver successful activities and helped to advance comprehensive, quality health service coverage for all Timorese. The United States of America is committed to continuing our support for the ongoing development of Timor-Leste. Most importantly, in health and in other key sectors, we are proud to work with the Timorese people to further develop a nation that is even more prosperous, healthy, and self-reliant. And with that, thank you very much. Obrigado, Barak, and I hope everyone has a wonderful day. Thank you.
Thank you very much, Sir. The Affairs of the U.S. Embassy, Mr. Mark Weinstock. Excellencies, ladies and gentlemen, and I would respect to invite His Excellency, the Vice Prime Minister, Minister Coordinator for Rural Development and Community Housing, Engenheiro Mariano Assanami Savino.
Respeito toma, kami convida Sa Excelência, Vice-Primeiro-Ministro, Engenheiro Mariano Assanami Savino, a dar o discurso. A favor.
Obrigado. Primeiro, ita agradece a Roma também. Pone a graça nera um dia que tautu bela sorumalo o condição que passando beke dia. Pane respeito a Dr. Flávio Brandão, vice-ministro da Saúde, que representa a ministra René. E a respeito para encarregar o negócio estrangeiro, o negócio embaixada dos Estados Unidos, vê que a cola sempre foi apoio e a respeito para embaixador Sira nebe maka oin presente René e a senhora Rebecca Robinson, diretora interino da missão Usaid, o senhor Ben, diretor da Usaid em atividade de sustentabilidade do sistema de saúde, o NGO Forum Pontil, diretor no BQN, o distintos diretores ou diretoras Sira nebe maka oin hamutukane, o itohutu nebe maka ita presença neba média precia baita hotu também baita hotu mai hamutu para olhar assunto ida nebe que importantes teves ba Timor-Leste. 20 anos liuba sistema de saúde sofre destruição anesan o setor circelo consequência russa violência nebe que quase 75% russa infraestrutura destruído e no nosso recursos humanos nebe maka ita e momento é neba 8 anos teves quando né Timor-Leste sempre tau saúde e a política não sempre e de princípio e de katak e a saúde e nebe maka sai base fundamento ba desenvolvimento desde tempo neba o enorme ita atinge buat lubu que daona e a área saúde nós sempre conta o apoio do governo americano, especialmente desde 2019, o Rússia e o Usaid tinha programa para sustentabilidade do sistema de saúde. Neve foi assistência técnica, no financeiro, para o Ministério da Saúde, na organização Sociedade Civil Lubuquida, neve serviço e setor saúde, e o foca para fortalecimento do sistema de saúde e a nível nacional, no moço e a nível município. Mesmo que ita melhoria buat baracona, mas bem, ita consciente que ita se docle o objetivo de desenvolvimento sustentado, o de estresse, saúde dia no bem-estar, no ita na visão RACIC, para plano estratégico 2023, nebe de hankatak Timor-One saudável e a Timor-Leste ida nebe saudável. Dados a tudo que passa mortalidade ina no labarik, sei as na fatin, as liu e a região asianian, mas bem, não no governo comprometido a fornecer serviço de saúde nebe maka ou qualidade a torradia indicadores hirakne e ne responsabilidade da ministra e ministro ou vice na rua toda a nida nebe maka compromisso primeiro-ministro nian kita tem que halau tem que esforço lor o pilar nebe maka define o programa no governo pilar de desenvolvimento capital social sai foco no responsabilidade de coordenação ministro coordenador assuntos sociais nian compõe Russi Ministério NEN, Ministério da Saúde, Ministério Social, Inclusão, Ministério da Educação, Ministério Assunto Combatente da Libertação Nacional, Ministério Juventude e Desporto, Ministério Ensino Superior. E a coordenação, o Ministério Tolo, nebemaka relevante teves, Ministério Social, o Ministério Saúde, no Ministério Educação, are liu, focal liu a saúde inan no labarik sira ICD, né, importante teves. Mas vê a tu centro hirak nebemaka precisa uluk ita anoin kata precisa teves, ita precisa hari centro cardíaco, nebemaka Dr. Flávio Rasik maka lidera para tu ya hospital lahane, né, importante teves, au hin kata tempo para vel hatona progresso, tamba Kita tem ministro Justiça ida, membro do governo ida mora sidane. E moras para que tebes nebe que la fiaron ita no hospital ne. Aruka bahu tu liur, tamane haus babise. Atu acelera la lais progresso. Au hen kata que tempo badak au se simo relatório ida kata que tempo badak se implementa ida ne. Asai capacidade de serviço nefrologia, rins e Hospital Nacional de Valadares. Ari centro atuare cuidados para oncológicos, né, importante. Anuene telefone médico sirian. E how aprecia também a Associação Médico Sira, mas foi ainda discute com a LIA e é um standard padrão é importante teves. A nível nacional, nível hospital nacional, mas bem, e precisa é standard, e precisa é padrão para clínica, e a CRAIC, e hospital será nível posto, nível município, nível posto ou clínica importantes, e a standardização, e a doutor hira, enfermeiro hira, parteira, e depois analítico, tem que completar a CRAIC, para ver for apoio saúde, emergência, saúde importante, nebe, e a área remota ou rurais sira. E a cuidado saúde primária, metas nebe maka Ministério da Saúde define maka hanesan aumenta 70% taxa inan feto sira isin rua irak nebe simo cuidados pré-natais pelo menos da lahat durante isin rua. Aumenta 80% taxa partos nebe maka assiste husi profissional de saúde. Aumenta taxa de cobertura de cuidado pós-natais para 90% e a semana rua, primeiro, depois de parto. E a nós temos cabe a responsabilidade para ministra e vice na rua para liderar. E nem tem compromisso. A maneira que tem compromisso, lá os dias discurso e a coalia, mas bem, nem tem que implementar. Nós nutrição, governo comprometido a tu taxa estante no 47% ba mais ou menos 30% 2025. A nós nem temos cabe a responsabilidade componente lubuquida, saúde, educação ou social, inclusão. E neita tem que esforço e é mic que não vai lidera, coordena, mas tem que esforço macas e constantil, nebe que anesan haremos ba segurança e soberania alimentar e nutricional, os componentes hoje nebe que alaram, ano é importante teves para tomatan e itakara ka tinzi duni a menos duni 30% 2025 ou 26. A tua atinge o Iraque e te precisa a tua ação integrado e estruturado no interligação nebe macadiac desde 2014, 2015 e a momento em que sei ministro da Agricultura e te lança ona desenvolvimento primária infância e te hamoso consantil e temos instrução hoje nebe a tua segura a varixira no malnutrição nebe que ita crônica ona já 47%. Excelência Presidente da República, Dr. José Ramos Horta, define assunto ICD nehanesan nini prioridade. No hausimo tutan responsabilidade da ne, o primeiro-ministro não é ao tempo badak anesan Ministro Coordenador, Assuntos Sociais, Nebema coordena, Ministério Tolo Importante, Saúde e Educação Social, Atubele coordena e Atubele finaliza ona. Política Nacional, Nebema Política Nacional, Nebema se aprova e Conselho de Ministro. Política de ne, o Hanoi e Russo na fatina apoio Usaid, a tua apoio governo implementa atividades no monitorização, no avaliação, ele realiza mehinar o que dene. e ne moso obrigação de ne maka ita moso a task force ne be maka umbrella coordenação ba liu ba agência nacional a Pontil homos embaixada Síria nomos agência ONU atubel halo coordenação harmoniza sincroniza itene programa para itabele sukat itania atividade sirene. Por último, o governo Timor-Leste nenaran e hanesan primeiro-ministro interino, no coordenador ba ministro coordenador ba assuntos sociais, akara ato agradecimento, nebe maka contribuiona, nebe maka o governo americano contribuiona ba projeto projeto Usaid, ba atividade de sustentabilidade do sistema de saúde, e a Timor-Leste nebe consegue atingir o objetivo nebe maka programa taona. No agradece bem para o povo americano, para Liu Usaid, para continuação apoio nebe fortalece o sistema de saúde e a Timor-Leste. E on behalf of the government of Timor-Leste, my sincere gratitude for your support for the government, U.S. government, U.S. people, and also embassy in Timor-Leste in here. Once again, deep appreciation for your support during the Timor-Leste independence. Your support not only in the health sector, but too many sectors you support. That's why, once again, deep appreciation on behalf of the government for the Timor-Leste. Thank you.
Thank you, Your Excellency. Sua Excelência, kari kita vele iha palku leten lei, ita vakas ba ceremony tirmai. Itabel Muda Podile, and we also would like to invite His Excellency, the Vice Minister, Mr. Mark Weinstock, Secretary of Affairs, and Rebecca, and also Sr. Valentin. Excellencies, ladies and gentlemen, we'll now start with the launching of two documents. The first document is Health Financing and Public Financial Management in Timor-Leste, a glossary, aims to help the technical analysts, health manager, directors, general directors, and students with interest in health financing. The second document is Health Management Information System Guidelines. We also crafted collaboratively with the HMIS Department and Development Partners, provides direction and standard for health data collection and analysis through the TLHIS in Timor-Leste. We also would like to invite the Chief of Party, Mr. Bavesh, to also join. And now, the Vice Prime Minister and also Mr. Mark Weinstock, you will have the Caesar as a symbol. We'll cut the ribbon for the launching of the two documents. And now, on the count of three. 1, 2, and 3. A big round of applause, ladies and gentlemen. The two documents are now officially launched. And for the photo session, can we bring also and now we invite Mr. Bavesh, the Chief of Party of the Usaid Health System Sustainability Activity, to hand over the Health Financing and Public Financial Management in Timor-Leste, a glossary, to DG Corporate Service of Ministry of Health, Sr. Marcelo Amaral. DG, halo por favor.
We would like to also invite the Usaid Acting Mission Director, Ms. Rebecca Robinson, to hand over the HMIS guidance document.
Okay, DG, halo por favor, dá foto lá.
Foto lá.
Thank you very much. DG, a mi convida bele fila falbaita ne fati.
Yeah, we would like to also invite Usaid Acting Mission Director, Ms. Rebecca Robinson, to hand over the HMIS guideline document to Mr. Alvaro da Silva dos Reis as Acting Director for Cabinet Planning, Policy, Cooperation, and Development in Health and Chief of Monitoring and Evaluation Department. Por respeito, me convida.
Okay, please stand for the photo. Thank you very much. Thank you, Sr. Álvaro. A mim convida pela fila Falveita Nefati. And now, Sua Excelência, está sem fotografia da lei. Hallo, por favor. Media.
Makers by improving their capability to conduct analysis for evidence-based policy advocacy and ultimately contribute to a more and strengthened health system in Timor-Leste. The grant was implemented on April 14, 2023 and will conclude in June 30, 2024.
The first grant is from Fontil, Teotoni Basalima.
And the next will be Hamutuk Ita Zudamalu Hiam Health, Ms. Rosaria M. Da Cruz, Director of Hiam Health. That will be handed over by His Excellency Mr. Flavio Brandão as Vice Minister for Operationalization of Hospital.
The objective of the award was to strengthen community health system in Ermera, Manafahe and Covalima municipalities by improving their capacity for community-based monitoring and strengthening the knowledge and skill of Hiam Health staff members to implement a social and behaviors change activity. The grant was implemented on June 20th, 2023 and will be concluded on June 30th, 2024. Once again, Hiam Health. Itotoni Vasalim. And now, Associations of Medical Doctors of Timor-Leste, AMTL. Dr. Rui Maria de Araújo, President of AMTL. Or Dr. Celia Guzmão Santos, the Vice President of AMTL. And over we invite Sir J.D. Affairs, Mr. Mark Weinstock.
This grant was awarded to strengthen workforce management in the public and private health sector to improve the quality of patient-centered service and ensure that healthcare provision meets minimum standard of care. The grant was implemented on December 21st, 2023 and will conclude on June 30, 2024.
Thank you very much, Dr. Celia. And now, St. John of God International Health. We invite Ms. Wendy Mori, Leadership and Quality Programs Manager of the St. John of God. And to the handover, we invite Man Rebecca Robinson.
The goal of this grant was to foster improved governance and change organizational culture, optimize organizational performance, and promote effective data utilization for decision-making within the Ministry of Health. These grants establish a process and design for a comprehensive leadership and management development program targeting key stakeholders, including the Director General of Corporate Service, Director of Human Resources, and the Cabinet for Policy Planning and Cooperation. The grant was implemented on October 23rd, 2023, and will conclude on June 30, 2024.
St. John of God International Health, ladies and gentlemen, Itani Vasalima.
Turma, me convida Hamutuk Nau Saudável Hamnasa. Me convida Mr. Paul Vasconcelos as the Country Director of Hamnasa.
And we invite the Chief of Party of Usaid Health System Sustainability Activity, Mr. Bavejain, to do the handover. Hamnasa was awarded with 2 grants under the activity. The first grant from January 31st, 2022 to December 16, 2022, aimed to promote accelerate widespread and equitable access to and deliver safe and effective COVID-19 vaccination in Timor-Leste and reduce morbidity and mortality from COVID-19, mitigate transmission and strengthen the health system, including prevent, detect, and respond. Ladies and gentlemen, Hamnasa.
And next, we would like to invite the Ministry of Health, Mr. Calistro da Costa Pacheco, as Head of Department of the Health, Statistic and Information Service, Ministry of Health.
And now we invite once again His Excellency, the Vice Prime Minister, to do the handover.
The purpose of this grant was to provide assistance to meet daily data entry requirements for the Timor-Leste Health Information System for COVID-19 immunization, tracker and routine health information data into Timor-Leste Health Information System, managed by Health Management Information System officer at the community health centers and municipality health service level of the Timor-Leste Ministry of Health. The grant was implemented on June 24, 2024-22 and will conclude on June 30, 2024.
And the last one, Charis Haburas Comunidade, SSA. So we invite Sr. Eusebio Abdia Sabrantes, Executive Director of SHC. And to do the handover, we invite Dra. Telma Corterial de Oliveira, Usaid Project Management Specialist, Health Governance.
This grant was to strengthen the existing community health system to improve positive health behavior and practice. Around inclusive reproductive, maternal, newborn, child and adolescent health and nutrition, and to contribute to reducing maternal and child morbidity and mortality in Alas and Tilomar by 2023. The grant was implemented on November 29, 2022 and concluded on September 30, 2023.
Dr. Telma, and we invite all the grantees to come back on the stage for photo session, please. And the Excellencies, if you can come forward, so that all the grantees to come back again. Para grantees e partners, Soto, a favor. Okay, Chair Sir Belsana, cadeira Sir Belsana.
Deletan, o respeito me convida para grande Sira, a favor, bele, agat vai palco, o de foto hamutuk.
Vai Excelência Sira, me convida a leitura e cadeira, grantee Sira se parte code. So there will be 3 photo sessions. The first one is with the grantees, and then we invite DGs, DNs, and Chief of Departments, all the officials from the Ministry of Health, to also join. And lastly, we're going to also have a photo with the Usaid and Usaid Health System Sustainability Activity Team. First photo, a favor, media. Thank you very much, grantees. You may return to your seat. Next, we invite DGs, DNs, and the Chief of Department from the Ministry of Health.
Ba grande Sira, a favor, bele, fila fala.
And INSB team as well. Para diretor-gerais, diretor nacionais, no chefe do departamento Sirroto, a favor. O Ministério da Saúde Indiano, a favor, bele mai, e tá sem fotografia.
Me convidamos ao CNPTL.
Oficiais do Ministério da Saúde indiano, na FATIM mantém a mútua excelências, firmai equipa Usaid, no Usaid Health System Sustainability Activity. A favor, equipa Tomac, bele hakat saberde. So this is the last photo session. And we'd like to also invite the development partners who are present here to also join. Thank you very much. Excellencies, ladies and gentlemen, we would like to request you to return to your seat. Thank you. Excelência, a me convida a tomar a fila para o Fati. Obrigado.
Ladies and gentlemen, now we have a traditional dance. Haksoke Heukferik is a dance original from one of Timorese municipality called Suai Kovalima. This dance represents our ancestor who used to dance in ritual ceremony and worship in the traditional house before war, and they celebrated victory by dancing the traditional dance named Haksoke Heukfei together with the community.
And now please welcome Kairala Cultural Association one more time. A round of applause. Once again, a big round of applause for Kairala Cultural Association. Thank you. And now, as the media interview happens with the key dignitaries, we'll have the Vice Prime Minister and also the Vice Minister and Acting Minister of Health, and also with the Charge d'Affaires, accompanied by Mana Rebecca and also Mr. Babesh for the interview. Please also visit or take the opportunity to see the posters placed around the venue. Technical leads will be available alongside the poster to share additional details with you if you require.
Ami convida ito hoto ato nebe visita mos poster iha parte sorin nebe ami tauna. Se precisa informação ruma, a minha equipa técnica disponível ato tulong ita voz hoto.
And for the media, for your information, a copy of a proof press release shared to media personnel at the start of our event. And now, I would like to invite Sua Excelência, Vice-Primeiro-Ministro, Senhor Ministro, Mr. Mark Weinstock, Man Rebecca, and also Man Babesh to come. Hello, forward. For media, ita bot sira, belhola fati. Senhoras e senhores sira, a favor, ita belharela poster sira, onhira interview rematati, kasi hakat keres baiten e almoço. A favor. Para media, a favor, ita ia minuto sanulu recent limited. Media, we only have 15 minutes. Please take your time. As the 15 minutes finish, we're going to conclude our event. Ladies and gentlemen, this is only a 15 minutes interview, and that's it. We'll conclude with the final.